Good evening, one and all. On behalf of Dr. Agarwal's Institute of Optometry, I'm very happy to welcome my team members, Ms. Meenakshi and Ms. Anshika, ma'am. Hi, both of you. Thank you so much for joining. And this is Optometry Series 2.0, and this is sixth episode. And for the last few episodes, we are making our alumni to join as moderators. The similar way, we have an excellent moderator today who is so young and completed her course 2 years back, and she's also the recipient of the prestigious Sudha Ma'am Award gold medal. I'm very happy to welcome our today's moderator, Ms. Shadhika. Thank you so much for joining with us, Shadhika.
Thank you, ma'am. Thank you, ma'am.
Yes. Okay, Anshi ma'am. So I've taken your work of introducing the moderator. Okay, I want you to tell about today's topic and why are we at the topic today, ma'am.
So as you already told that we are starting with 2.0 series, and now today we are going to talk about eyelid pathologies because we've already completed about eyelid anatomy. So once again, thank you Shadhika for chipping in and being a moderator today. So hoping that our students learn and gain a lot of knowledge from your experience of 2 years. So over to the MC for today.
I request Abishekina to start the MC part.
Good evening, Ananda. I am Abishekina, a third year Bachelor of Optometry student at Dr. Agarwal's Institute of Optometry. I am very happy to welcome our today's moderator, Ms. Shadhika, a proud alumna of our institute, and a distinguished recipient of a C14 Miss Sudha Gold Medal for outstanding overall performance during her college years and internship. Ma'am's journey into the world of optometry is marked by a unique blend of passion, talent, and dedication. As a fresher in the professional field, she brings a fresh perspective and boundless enthusiasm to her workplace. She is currently working as an optometrist at APT Vision, Chennai, excelling in the specialized area of fundus photography. We are truly honored to have you with us today, ma'am. Now, I am pleased to invite today's presenter, Mr. Nabin Raj, a third year student of Bachelor Optometry and dedicated member of multimedia team at Dr. Agrawal's team, Institute of Optometry. Mr. Nabin Raj, begin your presentation.
Thank you, Ms. Abishekina. Hello, everyone. Today's our topic is about common eyelid pathologies. Since we have seen the basic anatomy of eyelid in the previous episode, I will just quickly jump into the pathologies of eyelid. Blepharitis. Blepharitis is a subacute or chronic inflammation of the eyelid margins, common disease with various clinical types. Types of blepharitis: bacterial blepharitis, seborrheic or squamous blepharitis, posterior blepharitis, which is also known as meibomitis, parasitic blepharitis, a latch infestation. Bacterial blepharitis, chronic infection of the anterior lid margin, causative organism Coagulous positive staphylococci. Symptoms are chronic irritation, itching, lacrimation, gluing of cilia. Signs: yellow crusts, ulcers, red and thickened lid margins. Complications of this condition is lash abnormalities, uh, tylosis, e- eversion of punctum, recurrent styes. Treatment: lid hygiene, antibiotics, eye ointment and eye drops, topical steroids, ocular lubricants. Seborrheic or squamous blepharitis associated with seborrhea of the scalp, which is dandruff. Symptoms: deposition of whitish material, mild discomfort, irritation. Signs: white dandruff-like scales, hyperemic, hyperemic and greasy surface. Treatment: general measures, balanced diet. Treatment of associated seborrhea, local measures, removal of scales, combined antibiotics and steroid eye ointments. Posterior blepharitis, which is meibomitis, inflammation of meibomian gland, chronic meibomitis, commonly occurring meibomian gland dysfunction. The symptoms are chronic irritation, burning, itching, grittiness. Signs: white frothy secretion, prominent meibomian gland openings, oily and foamy tear film. Treatments are lid hygiene, warm compression, ex- expression of secretion, topical antibiotics, systemic tetracyclines, ocular lubricants. Parasitic blepharitis, infestation of lashes by lice, Thyris pubis or Pediculus humanus, corporis or capitis. Symptoms: chronic irritation, itching, burning. Signs: red and inflamed lid margins, lice, anchoring lashes, nits, adherent to cilia. Treatment: mechanical removal of lice and nits, application of antibiotic ointment and yellow mercuric oxide 1%, delousing of patient and family members. External aureolum. Etiology: Staphylococcus aureus infection, predisposing factors, age, habitual rubbing of eyes, chronic blepharitis, diabetes mellitus. Symptoms are acute pain, swelling, mild watering, photophobia. Signs: localized, firm, red, tender swelling at the lid margin, marked edema. Treatment: the treatments are hot compress, hot compression, evacuation of pus by epilating the involved cilia, antibiotic eye drops and ointment, systemic anti-inflammatory and analgesics, systemic antibiotics. Chalazion. Etiology: chronic non-infective lipogranulomatous inflammation of the meibomian gland. Predisposing factors similar to hordeolum externum. Symptoms: the symptoms are painless swelling, mild heaviness, blurred vision in rare cases. Signs: nodules slightly away from the lid margin, firm to hard and non-tender. Treatment: conservative treatment, hot, hot fermentation, topical antibiotic eye drops, oral anti-inflammatory drugs. Intralesional injection of long-acting steroid, incision and curettage, diathermy for marginal chalazion. Internal hordeolum. Etiology: Staphylococcus aureus infection, blockage of the meibomian gland duct. Symptoms: acute pain, swelling, mild watering, photophobia, similar to alveolum externum. Signs: the signs are localized, firm, red, tender, swelling away from the lid margin, marked edema. Treatment: similar to alveolum externum with vertical incision for the tarsal conjunctiva to drain pus. Molluscum contagiosum. Etiology: viral infection, large poxvirus. Symptoms are multiple pale, waxy, umbilicated swellings on the skin near the lid margin. Complications: chronic follicular conjunctivitis, superficial keratitis. Treatments: incision and cauterization of, of the skin lesions with tincture of iodine or pure carbolic acid. Eyelash disorders. The eyelash disorders are trichiasis, which is inward misdirection of cilia rubbing against the eyeball. The cause is trachoma, blepharitis, or any injuries. Treatment. The treatments are epilation, electrolysis, cryoepilation, and surgery. Dystichiasis. It's an extra row of cilia occupying meibomian glands. The types are congenital, acquired. Acquired are chemical injury, Steven-Johnson syndrome. The treatment is electroepilation or cryoepilation. Mardrosis, partial or complete loss of eyelashes. Causes, local or systemic. The local is blepharitis or surgery. Systemic are alopecia, so, psoriasis. Sorry. Treatment varies depending on causes. Entropion. Definition. Inward rolling of the eyelid margin towards the globe. Causes. Cicatricial, which is scarring, involution, age-related or congenital. Symptoms: ocular discomfort, vision problems, increased tearing. Signs: inward turning of the eyelid margin, corneal damage, conjunctival congestion. Treatment: conservative management, lubricants, botulinum toxin injection, surgical correction, which is lower eyelid retracting tightening. Complications: corneal ulcers, scarring, vision loss if left untreated. Ectropion. Its definition is outward turning of or sagging of the eyelid margin away from the globe. Causes: involution, which is age-related laxity, cicatricial, which is scarring, paralytic, facial nerve palsy, mechanical, tumors or scar tissue. Symptoms are exposure keratopathy, tearing, dry eye symptoms. The signs are outward turning of the eyelid margin, exposure of the conjunctiva and cornea. Treatment: lubricants, taping of the eyelid, botulinum toxin injections, surgical corrections. Example: lateral canthus tendon tightening. Complications are chronic exposure keratopathy, corneal ulceration, vision loss if left untreated. Next is the symblepharon. Adhesion between the eyelid and eyeball due to the chemical burns, trauma, or autoimmune disorders. The treatments are surgical lysis of adhesion, mucosous membrane grafting. Ankyloblepharon, partial or complete fusion of eyelid. Congenital or acquired. Treatments are surgical separation of the eyelids. Blepharospasm. The definition: involuntary and repetitive contraction of the eyelid muscles. Orbicularis oculi. Causes: unknown, but may involve genetic, environmental factor or neurological disorders. Symptoms are eyelid spasm, twitching, eye irritation, sensitivity to light, vision problems. The treatments are botulinum toxin injections, medications, surgery, myectomy, or deep brain stimulations, lifestyle modification. Prognosis: not life threatening but can impact daily life. Treatment can elevate symptoms, alleviate symptoms, but ongoing management may be needed. Ptosis. Definition: the drooping or falling of the upper eyelid, which can affect vision. The causes are congenital, age-related, trauma, nerve damage, or certain medical conditions. The symptoms are drooping eyelids, difficulty keeping the eye open, vision obstruction. The treatment is surgery, levator recession, or frontalis sling. orthosis repair surgery. Complications: vision problems, amblyopia in children if left untreated. Thank you.
You can stop sharing the screen, Nobin. Thank you so much, Nobin. That was a good presentation. Over to our moderator, Ms. Shadhika. Hi, Shadhika, ma'am.
Hi, ma'am.
Thanks for pitching in. We'd like to hear more from you on the pathologies of ID disorders.
Yes. Yes, ma'am. First, thank you for our junior who done a very good job. So there is nothing for me to say anything like it's more than enough. But let me tell you a few points. I'll just share my screen, ma'am. Can you see my screen, ma'am?
Yes, Shadhika, it is visible.
Yes. So first is today's topic is eyelid pathology. The first eyelid pathology we are going to talk about is inflammatory disorders of the eyelids. First is blepharitis. As we have said, there are various kinds of blepharitis. First one is seborrheic or squamous blepharitis. This is basically due to scalp, dandruff in the scalp, which spreads to the eyelashes. Then it will create the blepharitis. And then staphylococcus or ulcerative blepharitis. This is due to staphylococcal infection. The next one is posterior blepharitis. This is also known as meibomitis. So this is
Shadhika, not audible.
how about now, ma'am?
Yeah, clear, dear.
Yes. So parasitic blepharitis, as the name suggests, this is basically due to a parasite. So few of the parasites are chronic Demodox folliculorum, Theriasis palpebrum, crab loss, very rarely seen with the person who has head loss. The next common inflammatory disorder which are seen in clinic are basically external hordeolum, chalazion, and internal hordeolum. So external hordeolum is basically inflammation of gland of the rays or mole. So when we see the eyelid anatomy, the gland of rays is near the lid margin. So basically when the lesion starts in the lid margin, we can identify that it is an external hordeolum. Chalazion is because of meibomian cyst. So basically this will affect the meibomian gland. If we go for internal hordeolum, this is inflammation of meibomian gland associated with blockage of the duct. So basically, how can we differentiate between these three is external hordeolum will be majorly in the lid margin. Chalazion will be in the tarsal region or where the meibomian gland are present. Internal hordeolum will be with the meibomian gland and blockage of the duct. So basically from the center till the lid margin, it will be present. It is mainly seen in the inside of the lid. Then next one is molluscum contagiosum. As he said, this is a viral infection. It's like where we are seeing a chicken pox. So we are seeing this kind of lesions near the eyelid. Next, anomalies of the lashes and lid margin. First one is trichiasis. This is inward misdirection of the cilia. Cilia is like eyelashes. The next one is dystichiasis. This is basically congenital or acquired. This is extra row of cilia occupies the meibomian gland position. The next one is entropion. The major types of entropion is based on congenital, cicatricial, spastic, senile, and mechanical. Congenital is from the birth they'll have entropion. Cicatricial is basically due to the palpebral conjunctiva contraction will causes this cicatricial entropion. Spastic is basically spasm of orbicularis muscle. And ectropion. This is also similar to entropion. In this, the paralytic ectropion is due to paralysis of the seventh nerve, which is a facial nerve. So the picture I have shown in this ectropion is cicatricial ectropion. Here there is a scar in the near the lid margin. So it is pulling the lid towards S. Next is congenital coloboma. This is full thickness triangular gap in the tissue of the lids. Crypt of thalamus. This is lids will not develop when they are born itself. The next one is microblepharon. This is eyelids or abnormally small. So the appearance of the eyes of this person is basically it's like a proptosis. Next is symblepharon. So adherent of eyeball. Basically palpebral and bulbar conjunctiva is adhered here. This can be because of thermal or chemical burns, conjunctival ulceration injuries. Next is ankyloblepharon. This is adhesion between the margin of the upper and lower lid. Blepharophemosis is the extent of the palpebral fissure is decreased. So basically this person will have palpebral fissure height and the width will be in lesser. Next is lag of thalamus. This is inability to voluntarily close the eyelids. The cause of this is paralysis of orbicularis oculi muscle, cicatricial contraction of lids, symblepharon, severe ectropion, proptosis. The next one is ptosis. Ptosis is abnormally drooping of upper lid. So basically our eyelid will cover 2 mm of the cornea. If a patient has ptosis, the cornea will be covered more than 2 mm. This can be classified as congenital and acquired. Acquired is basically classified further as neurogenic, myogenic, aponeurotic, and mechanical. Neurogenic is basically when there is a nerve issues. Myogenic is basically muscle issue. Next, tumor of the lids. So these are classified as benign tumors and malignant tumors. Benign tumors is further classified as simple papilloma, xanthelasma, hemangioma, neurofibroma. Malignant tumors is further classified as squamous cell carcinoma, basal cell carcinoma, malignant melanoma, and sebaceous gland carcinoma. So, thank you.
Am I audible?
Yes, ma'am.
Thank you so much, Shadhika. It was a very crisp and clear explanation about eyelid disorders.
Thank you, ma'am.
And from the student's perspective, what would you think they are missing out on identifying eyelid disorders? Am I audible, Shadhika?
Yes, ma'am.
There's a question. From the student's
Yes,
perspective,
ma'am.
what do you think they are missing out on identifying eyelid disorders?
Okay. Can you come again, ma'am?
She's asking from the student's perspective, what do you think the student
Okay.
missing out on eyelid disorders? So that's a question from the student
So
side. How do they not miss out on any eyelid pathology?
okay, so basically, when we are doing an examination, we'll start with eyelids. So from the lashes, then we'll go ahead for eyelids. And if we see there is confusion between what eyelid pathology is what. So that is why I'm telling you, like chalazion, internal hordeolum and external hordeolum, you should identify based on the position and what are their signs and symptoms. That is how you can identify an eyelid pathology, or that is how you will not miss eyelid pathology. So you should start from the eyelids. Is it?
Thank you so much. Yeah, thank you so much. The second question is, how do we differentiate chalazion from the stye?
As I said, stye is basically like external hordeolum is basically the inflammation of gland of rays. The gland of rays will be in the eyelid margin. Chalazion will be inflammation of tarsal plate or meibomian gland. So the chalazion will be in the middle. Like here, you'll have the lesion. That is chalazion. And in external hordeolum will be in your lid margin. So by that way, you can identify the difference between stye and chalazion.
Thank you so much, sir. The next question is, how important is the slit lamp or torchlight examination in case of eyelid disorders?
Of course. So basically, what we learn will be different and what we do is different from the start. As I said, first we have to check the eyelid. Why? Because these are the condition we will tend to lead. So first we have to always check with the lids, lashes, lids, and then we have to go for further parts. So what will happen if we leave a chalazion? Then that will lead to further conditions.
Thank you so much, sir. To add up to your points, to differentiate between stye chalazion, based on the pain intensity, stye will be even more painful than the chalazion. It is in the lid margins, right? It is also get infected.
Yes, yes.
So by that way, they can also identify the differentiate the stye and chalazion from the clinical aspects. And that's it. Over to Gomati. There are no more questions. Sorry, Anshi ma'am, do we have any questions, ma'am?
No, I think we've had a very good deep discussion on the eyelid pathology. So thank you, Shadhika. I don't think we'll have any more questions.
Thank you.
I think it's more important that students learn about the eyelid pathologies, and as very, very important that they should know how to diagnose them and how to not miss them when we are doing a complete evaluation. So initially, as you very well mentioned, in the beginning itself, eyelids is what we see at the first, whether it is a slit lamp evaluation or whether it is a torchlight evaluation. We should make sure that we do not miss on seeing out in the eyelids and then move on further whether we want to look for anterior segment or any other pathologies. So eyelids are equally important because that's where eyelids are basically the gateway to providing any infection, stopping any infection entering the eye. So if we miss out on diagnosing any conditions out there, we will definitely leave the patient back with irritation or discomfort. So thank you, Shadhika, and thank you, Nabin, for such a detailed presentation. Over to you, Gomati.
Thank you so much, Hanshi ma'am. Thank you so much, Shadhika, for joining us as a moderator for the day. And we'd like to host you on another wonderful platform. And dear audience, thank you all for your continuous support towards Optometry series. We have an announcement this particular week that in the upcoming week, we have got the entrance examination for masters. Since Hanshi ma'am is here, ma'am, can you add more points about like when is the entrance examination, what is the eligibility criteria and more, ma'am?
Thank you so much, Gomati. Very, very important announcement as we are starting the academic year. So we have Masters of Optometry affiliated to Bristol University, and for it we have entrance exam on 23rd June. It is at our college campus from 11 o'clock. So those who have completed a bachelor's degree in optometry, a 4-year complete course, are all eligible to apply for this entrance exam. It will be an MCQ based questionnaire, questions. Apart from that, clinical assessment will also be there. So anybody who is interested, please do join in and come in for upgrading your knowledge in optometry at Dr. Agarwal's Institute. Thank you, Gomati.
Yes. So not only masters, this season being the admission season, admissions are open for bachelor's, masters, fellowship and internship in optometry also. So anybody who is interested to pursue a career in the field of optometry, please do join us. And the second exciting announcement for this particular week is we are just 11 days away from the abstract deadline for the ISBTech. So ISBTech is a very important collaborative conference with Dr. Agarwal's Institute of Optometry and Laila ICAM College, Chennai. So those who are trying to upgrade yourself, or you are into innovation or future in the future eye care thing and all of that, you all can start registering. And if you have any papers, you can submit your papers also. So once it is getting selected, it will be published also. So Anshima, would you like to add more points on ISV Tech also?
So ISVTech, as Gomati said, is International Systems in Vision Technology and Eye Care, and we are hosting this conference along with Loyola Engineering College. So we have a lot of optometrists who are now working with engineering colleges together, working on diagnostics, devices, artificial intelligence, and whatnot. So anybody who is interested, please do chip in. We have our website on ISVTech. If you Google it, the website will open. Abstract submissions are open. Paper, even if you are submitting abstracts and if you want it to be published, we are also helping in paper publications. The conference is on 25th and 26th October. It is on a weekend. 24th and 25th October, it is on a weekend. So definitely, please, all of you do join in who is interested in this particular conference.
So thank you so much, Anshika ma'am. Thank you all, dear audience. In the description box, you can find the link for all the updates about Dr. Agarwal's Institute of Optometry. If you like this video, give a thumbs up and share with all your friends. Meet you all in the next episode. Thank you, Shadhika. Thank you, Anshika ma'am. Thank you, Meenakshi. Bye, everyone.
Thank you, ma'am. Bye, ma'am.